Texas is facing a dire shortage of primary care physicians.
Some doctors are now pleading with the legislature to restore funding to a mentorship program that was severely slashed in the 2011 budget cuts. They say the funding could help bring more doctors to a neighborhood near you. KXAN's David Scott explains.
No matter what ails you, no matter what specialist you may need to see, your primary care physician is the gatekeeper to all of it, and we're desperately short of them. Our population boom and the lure of lucrative specialties means less primary care doctors. So many of us have to resort to ER or postpone our care. The decades-old mentoring program teams primary care doctors with impressionable medical students, and it works.
And we know from our data that those students are 20% more likely to stay in primary care and also 20% more likely to stay in Texas.
Dr. Chase Maxwell was mentored in 1997. Now, he's passing his enthusiasm on to new students.
Because if you take one person like me and kind of turn them on to primary care and get them excited, they come back to a training program where they're teaching residents in primary care, and you sort of pay it forward.
Dr. Maxwell might have become a specialist in New England, but he chose to stay here.
And you have these patients that you treat for their entire lives in some cases. That's the rewarding part. That's what keeps people coming back to it.
They hope lawmakers are listening. David Scott, KXAN News.
Doctors want to more than triple the money that was cut from the primary care mentoring program, increasing it to $4 million over the next 2 years. Here is one example of the need we have for general practitioners in Texas. According to Seton Healthcare, the workload for doctors will increase by 30% by the year 2025. Yet the supply of those doctors is only expected to grow between 2 and 7%, leaving a big gap in care for our community.